Did you know that 60% of women over the age of 30 experience a pelvic health issue at some point in time in their life? Tonight we're going to explore why and what you can do to prevent pelvic health pain and discomfort as you age. Hi, I'm Katie Wolfley. I'm a physical therapist, and tonight I'll be joined by fellow physical therapists Mary Roberts and Heather Gronkowski to focus on a vital topic: pelvic health for women aged 30 and beyond. Pelvic health issues can vary from discomfort or pain to urinary incontinence or constipation. And while tonight's about pelvic health, core strength, it's always important to listen to your body and speak to a physical therapist before starting any program. In tonight's class, we will explain and emphasize the importance of pelvic health for women as they age, address common pelvic health issues and preventative measures that can be taken, and share actionable tips for long-term pelvic health wellness, including some core exercises to try. As we progress through tonight's program, please make sure to put any questions that you have in the chat. Mary and Heather will cover them later during our live Q&A. So without further ado, I welcome Mary and Heather.
Welcome to our pelvic health and core class. I'm physical therapist Heather Gronkowski.
And I'm pelvic health physical therapist Mary Roberts. And today we're going to be going over what is pelvic health, why is it important, and what can you do about it if you have pelvic floor issues going on.
So Mary, what is pelvic health and why do women over 30 need it?
Well, let me tell you. So if we look here at the pelvis, this is mainly what we focus on with pelvic health, right? This is a center. You also can work some through the core and through your hips. But if we look specifically here within the pelvis, we can see our pelvic organs. That includes the bladder, vagina, uterus, and rectum. And if you look underneath these organs, we can see all of these different pelvic floor muscles. And you actually have 12 different muscles in 3 different layers here. And because of how close these muscles are to our pelvic organs, they can influence each other. So with pelvic floor issues, we oftentimes see issues with bowel and bladder continence, sexual function, and then we can also see some issues that occur during or after pregnancy.
So what function does the pelvic floor have and what issues do you see?
So there are 5 different functions to the pelvic floor. We call it the 5 S's. The first is a sump pump function. The same way that our muscles work to help work blood back up out of our legs, our pelvic floor works to help get blood back to our trunk. The second function is a sexual function. There's also a sphincteric function, which works both for bladder and bowel. Then there is a supportive function, right? We think about these pelvic muscles like a hammock that support the pelvic organs. And then there is also a stability function, which is where the core comes in, because the core and the pelvic floor work together to give this part of our body the stability that it needs. Now, when it comes to those things, there are many different issues that women can have along those lines. So if we look specifically postpartum, we can see if women have an episiotomy or have tearing, they can develop scar tissue, right? And we know as therapists that scar tissue restrictions can lead to limited mobility and pain. And when you have scar tissue in that area, we can oftentimes see pain with intercourse. Also postpartum, women can have a separation in their ab muscles called a diastasis recti or diastasis recti, it's the same thing, meaning that they have core weakness. And then also within those pelvic floor muscles, you can get what are called trigger points. So the same way that you can get a muscle knot in your neck or your shoulder, you can also get a muscle knot in your pelvic floor, and that can lead to a variety of different symptoms, including pain like we just talked about, as well as urinary urgency and frequency, meaning you got to go to the bathroom really frequently, more often than every 2 to 3 hours, and that when you have that sense of needing to go to the bathroom, it's this emergent, I got to get there right now or else I'm not going to make it. And then these muscles can also become weak, right, and incoordinated. Those oftentimes go together. Think about your bicep, right? If I say flex your bicep, you can go ahead and bend it, and you can see your bicep moving. You can see your arm moving. Well, when we do a Kegel, we don't see the Kegel muscles moving, so we oftentimes don't know if we're doing it correctly. So with physical therapy, we can work through these things to make sure that the pelvic muscles and the core muscles are really working to help you out.
So how do hormonal changes affect the pelvic floor?
Well, there are really 2 points in time where we see these hormonal changes really impact the pelvic floor. Earlier on, we see it happen postpartum. Especially if women are breastfeeding, it puts your body in what is called a menopausal state, right? So we have the same symptoms that we have with the true menopause, but it only occurs during breastfeeding and it improves once you stop breastfeeding. It's a normal part of that period of time, but it is good to be aware of it. And then we also see with postmenopausal women, the same things happen. So in both of these groups of people, we see that there is muscle atrophy, right, in the pelvic muscles. There is also some vaginal dryness that occurs. So when you have muscle atrophy, it affects the strength of muscles, right? So when those muscles become weak, we can see leakage, we can see a bit of that pelvic organ prolapse, which is where these pelvic organs within this model don't stay where they are. So with pregnancy and having children, and then also those hormonal changes, the support here is reduced, so these organs can start to sink down, right? The bladder can sink down, rectum can sink down, the uterus can sink down. And a lot of times when that happens, women will complain of a feeling of pressure, heaviness, sometimes even say it feels like something is going to fall out. And it's because these hammock of muscles are not properly supporting these organs. So if you're experiencing symptoms like that, we want to make sure that we are working to get those muscles stronger. And then with the vaginal dryness that can also occur, that oftentimes can lead to pain with intercourse, pain with if you're using tampons or inserting anything, right? Or if you go to the gynecologist, it can also lead to pain with that. So one of the things that people think, especially when they're postmenopausal, is that this is just the way my body is, right? I just have to adjust and live like this, and that's not true. For all of these issues, a lot of times women think that it's normal, right? It's normal to have leakage after having a baby. It's normal for sex to hurt after having a baby. Or I've gone through menopause, I'm gonna leak when I sneeze, right? A lot of times people think that that is normal, but it's not. Right, just because it is common, just because, like Katie said, 2/3 of women experience this at some point in their life, doesn't mean that it's just the way it is and they have to live with it. So you want to make sure that when you have these issues go on, you're addressing them and knowing that there are resources out here that are available for you to work with to help get them addressed.
So what can women do to prevent and address pelvic health issues?
So really having those regular checkups with your doctor is very important. It is much easier when it comes to anything going on in your body to address it sooner rather than later, right? So if you are just starting to have a little bit of urinary leakage and it's only when you sneeze, talk to your doctor about it. They can talk about pelvic therapy. You can ask them about pelvic therapy. And it'll be much easier for you to get it addressed and get that leakage resolved than if you live with it for the next 10, 15, 20 years and it gets to the point where you're wearing multiple pads or multiple Depends a day. Now, that being said, if that is you and you have had this go on for a very long time, we can absolutely work to get it better, right? It doesn't mean just because you've had it for decades that it's stuck, right? Physical therapy can definitely be helpful in addressing these issues. You also want to make sure that you're not ignoring the symptoms as they are occurring, right? So again, common symptoms that we see with therapy is urinary urgency, urinary frequency. If you're leaking on the way to the bathroom, even if it's just when you get into the bathroom and are unbuttoning your pants, it's worth getting it addressed, right? If you start to feel that heaviness or that pressure, even if it's not all the time, let your doctor know. Oftentimes the early on symptoms of a prolapse are that heaviness and pressure after you've done some heavy lifting or been on your feet all day long. I hear a lot of women say, they go out for a walk for a couple miles, they come back, they feel some heaviness. That is a great time to bring it up. And then if you're also having any pain with intercourse, again, that is not normal, and you can work with doctors and therapists so that you're not having that pain. And the same thing with leakage. A lot of times when women come in, they say, I don't leak, I just have a little come out when I sneeze. That's still leakage, and that is still worth addressing.
So with all that being said, what does a healthy pelvic floor look like?
Yeah, great question. So what we should see with a healthy pelvic floor is that you are going to the bathroom every 2 to 3 hours, which ends up being around 6 to 10 times a day. Now, in women who are younger than 65, you should not be waking up at all at night to go to the bathroom. If you are older than 65, waking up once or twice, that's considered pretty normal. We also want to make sure that we are having healthy and consistent bowel movements. There is a wide range of what is normal. Everybody's GI system works a little bit differently. So you may be having 2 or 3 bowel movements a day, and you may be having a bowel movement every day or every other day. That is all perfectly healthy. And you want to make sure that you're able to function with the pelvis as you want, right? That it's not limiting you. So you should be able to have intimacy without pain. You may need the use of lubricant, and that's totally fine and totally healthy. You should be able to pick your kids up, pick your grandkids up, jump on a trampoline, right? Do those things in your day-to-day life without having to be concerned about, oh, will I leak? Oh, will this cause me to feel a certain way down the road? So it shouldn't even have to be a thought in your mind of, is this going to impact me, right? You can do what you want without limitation. And if you do have something going on within those pelvic muscles, from us talking today, we're gonna go over some different exercises that can be helpful with it. I'm first gonna go through some core strengthening and pelvic strengthening exercises. These can be really helpful if you have weakness. And weakness looks like urinary leakage, maybe some bowel leakage, pelvic pressure, pelvic heaviness, if you feel like you have core weakness. The strengthening exercises we do today will be very helpful for that. And then later on, Heather is going to go through some fantastic stretches for the pelvic floor. And the stretches can be really helpful if you have muscle tightness, right? Those muscle knots that we talked about. And that, again, oftentimes looks like urinary urgency, urinary frequency, and pain with intercourse. So you will get to see what many different types of exercises look like for the pelvic floor.
Do you feel like you're slowing down? Feeling older? Like you're out of routine and tired of being tired? Ready to get moving and take control of your health? Introducing Indie. We help everyday people move, exercise, and live an independent life. Indie provides safe, low-impact workouts designed by a team of physical therapists.
We're gonna work on balance, strength, and mobility. Get control of our pelvis. We wanna get control of that core.
Unlike other programs, you won't be left feeling exhausted, injured, or struggling to keep up. Get moving and improve your life today. Try for free. Visit indiemoves.com and get moving.
All right, so let's go over a couple of pelvic and core strengthening exercises that are great to do at home and you don't need any equipment for it. So the first thing that we're going to go over is how to engage one of your core muscles called your transversus abdominis. This is a deep core stabilizing muscle. A lot of times when we think about our core, we think abs, but this muscle isn't just here. It wraps all the way around and it acts like a corset, giving us a lot of stability. So again, one of the functions of the pelvic floor is a stability function. We want to make sure that our core is working along with that. So it's easiest to feel this muscle in the lower portion. So if you press just inside of your hip here on this left side, Heather, perfect. And now I want you to go ahead and cough. So what do you feel happen underneath your fingers when you coughed?
A little bit of pressure and it tightened up.
Yes, it tightened up, the muscle lifted and got firm. So now we want to see, can you do that without the cough? So I like to think about doing this as if you are flattening your back down to the table, and your breathing does matter. So Heather, as you breathe out, I want you to gently squeeze your lower belly, perfect, just like you're flattening your back to the table. And then relax while you breathe in, squeeze while you breathe out. Yep. So keep on going just like that. So I know we don't see a ton happening with this exercise, but you should be able to feel it. So again, it is that firming up of the muscles. It is different than sucking in your belly. A lot of times too, people want to do a big squeeze here instead of that lower part of the abdomen. And so we want to make sure that you are pulling from the bottom up. You can also think like you're trying to zip up your abdomen. So we can see here how her muscles are tightening up and her ribs are closing down with her. See those ribs close down? So now instead, Heather, I want you to suck in. Just suck in breath. So see when she sucks in, how her ribs expand? We don't want that. So thinking when you tighten, you're closing everything down here. Good. Go ahead and take a break from that one. So this is a great framework for any core exercise that you do, because we want to make sure that the right muscles are engaged. And if you squeeze that muscle first, you will have those core muscles ready to do whatever movement you're about to do. Now the next exercise we're going to go into from here is a bridge. A lot of you have probably heard of bridges before. So Heather, why don't you go ahead and show us. So what you do is you squeeze your butt muscles, squeeze your glutes, and you lift your hips up so that you're in a straight line. Come back down. Good. So go ahead and keep on going just like that, Heather. Now you can see she goes up just enough so her body is straight. She doesn't lift her hips so high in the air that she is arching her back. We don't want to arch the back with this one because it's going to put a lot of strain through our low back area. And if you're doing this and you can't get your hips up as high as Heather is, no problem at all. Get them up as high as you comfortably can and then lower back down. So we want to work at whatever level you're able to do. Now, if you're doing this exercise and you're thinking, this is easy, I could use more of a challenge, then what you can try doing is a single leg bridge. So lift this leg up in the air. Yep, you can have it straight, you can have the knee bent, whatever is comfortable, but you do the same exact thing, but now you're only doing it with the one leg. So you're really challenging that one side. And these one-legged exercises are really nice because we oftentimes have one leg that is stronger than the other. And if we use both legs, the stronger one is going to take over and do more work. Yep, go ahead and switch. And if we single out and use one leg at a time, you'll make sure that you are correctly using both sides. And you may notice when you're doing this, while it feels a lot harder to do the bridge with one leg versus the other. So does one of these feel harder for you?
Yeah, the left leg felt harder.
Left leg felt harder. So Heather's right leg is probably stronger than her left. She probably has a little bit of weakness in that left side. So it's good to do those single leg exercises to help with that. The next exercise we are going to do from here is called dead bug. Now dead bug uses that core brace. So the first thing I want you to do, Heather, is get that same core squeeze. Now you should be able to hold this squeeze and keep on breathing. So make sure you're not holding your breath. From here, both arms come out straight in front of you like a zombie. Both legs lift up so that the hip and knee are bent to 90 degrees. And then what Heather's going to do is raise one arm overhead as the opposite leg comes down. And then you go back and you switch. Perfect. Heather's doing a really good job with this. You want to make sure as you are doing this movement, your back is staying pinned flat down to the mat. So you don't want an arch to be in your back. If you do end up with an arch in your back, what you can do is instead of straightening your legs like Heather is doing, keep your leg bent and just tuck one leg, just one, as the arm goes overhead. Yep, and just come back up and then switch. So if you keep the knees bent, it won't be quite as much work on your core. If you want to do an exercise like this at home and you have a yoga ball or something like that, you can hold the yoga ball between your hands and your legs, and that will give you an added challenge. But Heather could probably tell you this is a hard enough exercise on its own if you're making sure that you're using those core muscles. Perfect. All right. Thank you, Heather. The next exercise we're going to do is called bird dog. So bird dog is just like dead bug, but instead of being on your back, you're on your hands and your knees. And they've actually done some research studies with this that show that when you do this bird dog exercise, you also do a Kegel. So again, it's great for the core, it's great for the pelvic floor muscles. So in this position, Heather can again engage that core muscle. Her back is nice and straight, and she straightens out opposite arm and opposite leg, and then brings them back. And you can see as she is doing this, here is staying pretty still, right? It's not moving a lot. A lot of times, if you have a lot of weakness, or if you're not just quite sure how to use the muscles correctly during this exercise, your hips will kind of drop and rotate. So try with this next one, Heather. Don't use your core, just let your body do whatever it does. So we can see there's that big dip, right? Because she's not engaging her core correctly. Exactly. So go back to engaging your core. So this is much more beneficial, right? Because we're using the right muscles to stabilize here. Perfect. All right, Heather. The last exercise we are going to do here is called a bear pose. So you start off on your hands and your knees. Tuck your toes up so they're underneath you. Engage that core muscle. Lift your knees just up off of the mat and hold. Now, you want to make sure that you are breathing during this exercise. If you're holding your breath, you're not engaging the core the way that you should. When you need a break, you can lower down. But we'll see how much of a challenge we can give you. So you want to make sure that you are breathing during this exercise. You also want to make sure your back is nice and level, right? She doesn't have an arch in her low back. And we like to work endurance for the core and pelvic floor muscles because of that stability function, right? We are up moving all throughout the day. When you are getting in and out of a car, carrying groceries in and out of the house, you're using your core muscles to prevent you from tipping over. So we need to make sure that these muscles are able to be engaged over a longer period of time. Now, if this is too easy for you, what you can add in are shoulder taps. So, yep, you got it, just like that. Perfect. So she has good form. Even being a little shaky, she's doing it correctly. So this is a good challenge for her with this exercise. Good. And with the shoulder taps, the nice thing is that you are getting the endurance piece, right, of holding the bear pose, but you also have a dynamic movement of tapping your shoulders. That is very functional. And the idea of these exercises is to work towards function. So again, you can do the things that you need to do in your daily life without being limited by what your pelvic floor and core can do. So those are some great exercises that can help to strengthen your core and your pelvic floor. So feel free to give them a try at home later as well. And remember, if you have any questions about anything that I just talked about or any of the exercises that we just did, drop it in the chat and we'll address it during the question and answer later tonight. I will now turn it over to Heather. So Heather, what are some daily modifications that people can make to support their pelvic health?
That's a great question, Mary. So we talked a lot about what pelvic health is, but how do we address issues with pelvic health? So there are a lot of daily modifications that we can make to our lifestyle that will help with this, such as diet, exercise, and lifestyle modifications. One thing that we hear very often that helps a lot with general health is make sure you're consuming enough water. Consuming enough water can help with a lot of different pelvic irritants and can avoid a lot of issues down there as well. Caffeine, alcohol, carbonation, and artificial sweeteners are many common irritants that will cause irritation and affect your pelvic health. And staying hydrated is super important because it will also prevent concentrated urine, which can irritate the pelvic floor as well.
So what is the link between constipation and pelvic health, and how can we address this issue?
Yeah, so a fuller bowel takes up space in the abdomen, which can press on different organs, especially the bladder, which can contribute to urinary leakage, but can also cause pelvic discomfort. We recommend a fiber intake of about 25 to 35 grams of fiber, which you can add into your diet with what you're eating, but also there are supplements as well that you can take. Taking a probiotic also can help because it will improve good gut bacteria and good gut health as well. This will improve digestion, which will relieve constipation-related pelvic health issues and discomfort. A fact you may not know is that our hips should be greater than 90 degrees when we're using the bathroom. This is in order to ensure proper alignment of the colon, which is the ideal position for eliminating waste when we're using the bathroom. This will ease constipation and relieve related pelvic health issues as well. This will also help with relaxing the pelvic floor muscles. You can also do this by utilizing either a trash can to put your feet on while you're using the bathroom. You can use a bunch of rolls of toilet paper to help raise your feet as well, or implement the use of a squatty potty, which is specifically intended for this use. It's just stored right next to your toilet, and it helps to raise your hips when using the bathroom.
Awesome. And so what daily practices can we implement to just address these general pelvic health concerns that we may have?
Yeah, so the first, of course, is exercise. So stretching the pelvis helps a lot because it will help relax and relieve the pelvic floor muscles. But also strengthening is important as well, like we went over with Mary. Strengthening the core and the pelvic floor helps address urinary leakage, urinary urgency, and also pain with intercourse. Another exercise or practice that you can implement is deep breathing or diaphragmatic breathing. This helps relax the pelvic floor. Our pelvic floor clenches with stress, so implementing these breathing exercises can help reduce stress, but also help just relax the muscles of the pelvic floor area. Breathing exercises will help relieve discomfort due to strain, so it's very helpful to implement this practice into your lifestyle. Another practice you can implement is working on proper posture. A lot of times throughout our day, we find ourselves in that hunched position with rounded shoulders, typically if we have desk jobs or other seated jobs. This will increase pressure in your abdomen by kind of closing down that space, and that will again put more pressure on the internal organs, including the pelvic floor. If we strengthen our abdomen and our back, this will help keep that aligned proper posture, keeping our chest open, and working on chest opening exercises as well will help just kind of keep that open posture and open abdomen. This will relieve symptoms by relieving pressure in the abdomen and reducing pressure on the pelvic floor. So next, I'm going to show you some of these exercises to try. So grab a yoga mat and let's get back down to the floor. I'm going to start by showing Mary a breathing technique that you can utilize. So Mary, go ahead and lie down on your back with your knees bent. So breathing exercises can be beneficial for people with urinary leakage or really tight pelvic floor muscles. So this will help relax the pelvic floor muscles, reduce stress, can help with urinary leakage, that kind of stuff. So this can be done anytime during the day, morning, night, whenever you kind of need that stress and relaxation release. So Mary, I'm going to have you start by putting one hand on your chest and one hand on your stomach. So this is going to give us a little bit of feedback on if we're doing this technique correctly. So I'm going to have you take a deep breath into your abdomen. You should feel your abdomen expand and the hand on your chest shouldn't move. So all the movement here is coming from Mary's abdomen, as you can see. Gentle rise and then gentle relax as she breathes in and out. Really focus on breathing deep into your core and try to focus on that feeling of relaxation all the way down to your pelvic floor muscles. So Mary, take a few deep breaths for me. Breathe in and then gently out. You can see the rise and fall of her abdomen, and that's how you know that she's doing this technique correctly. And then again, the hand on her chest is staying very stable. Good. So the next exercise we're going to do is a stretch for the pelvic floor and the hips. So I'm going to have you raise your knees, raise your feet, and you're going to grab your ankles, inside of your ankles, and kind of pull towards you, pressing your shoulders down towards the floor. So this again is a really good stretch for the inside of the thighs here, the pelvis, and will help kind of relax and loosen everything as well. Practice that deep breathing as well while you're doing this exercise, just to help everything relax. You shouldn't feel super tense in this stretch. If it feels really tight or uncomfortable, or you just can't reach your ankles like this, you can always grab onto the back of your thighs as well. And again, work on pressing those shoulders down towards the mat and just letting everything relax as you take some deep breaths in and relax, release. Again, focusing on just keeping everything nice and relaxed all the way from your chest, all the way down to your abdomen, to your pelvic floor. Good. All right, so the next exercise we're going to do, I'm going to need you on your stomach for me. Okay, what we're going to do, I want you to bring your elbows underneath your shoulders, hands and palms spread wide and press down into the mat. I want you to really focus on bringing your shoulders back here. This is a great postural stretch. So this is going to help open her chest up and really expand through her abdomen. So this one doesn't need reps as much as it's more of a static hold. So you should really feel this stretch through the chest. And again, come back to that nice deep breathing to help let everything relax. You shouldn't feel super tense in this posture. The only place you should really feel your muscles tightening is through your back and your shoulders here, just to keep everything nice and open and stretched out here. Great postural exercise for you as well. All right, so the next exercise we're going to do, we're going to stay in this prone position. Have her come back up onto her hands, bend her knees, and press her hips back towards her heels into a child's pose. So fingertips are going to stretch forward as her hips sink back. Try to get your hips as close down to your heels as possible. You should again feel this stretch through the inner part of the thighs and the hips, as well as through the back and the shoulders a little bit too. The wider you take your knees, you're going to feel a little bit more of that stretch in the pelvic and hip area, and really focus on pressing your chest down towards the mat here. Stretch your fingertips out really far forward as well. If you feel any discomfort in your knees here, you can always take a pillow or a cushion and put it below the hips. That's going to help release a little bit of that tightness in the knees as well. Yep. So it'll just kind of raise your hips a little bit and take a little bit of that pressure off the knees. So again, here we're just focusing on that deep inhale and exhale as we feel that stretch all through her hips, all the way to her shoulders, and kind of opening up the hips as well here. So the next exercise we're going to be doing, Mary, you can come on up. We're going to go all the way into standing. This next one is known as a yogi squat. So another great opening stretch for the hips. So I want your feet a little bit wider than hip distance, and your toes are going to be pointing to the outer corners of your yoga mat. And you're going to kind of lower your hips down into a squat position, using your elbows to push the inside of your knees outwards. Good. So you should feel that stretch again throughout the hips and the inside of the thighs here. A modification for this one would be to use a chair. So same thing, feet wide, toes pointed out. You're going to sit down in the chair, hands again in prayer, elbows on the inside of the knees, using your elbows to push the knees out to really get as deep into that stretch as you can. Again, here we'll focus on that deep breathing and relaxation to help relax the muscles while we get a good stretch there. All right, Mary, you can stand back up for me. The last stretch we're gonna do is known as a sink stretch, and that's because we use a sink usually for support for this stretch. We don't have one here today, but we're just gonna be using the back of a chair. I don't recommend using anything that's super unstable, so I would try using a countertop or the edge of your sink for this one. So Mary, what I'm gonna have you do is put your hands right there on the back of the chair. Again, feet wide, wider than hips width distance, and you're gonna sink your hips straight back to feel a nice stretch through your back and your hips here. Again, this is a stretch we're gonna hold for a little bit of time, so really focus on that breathing, that relaxation as you feel that stretch through your hips and your back. And you can come on back up. So this is a great stretch also to help relieve any tension in your back as well, and works a lot on posture as well.
Does it matter if the knees are bent or not?
It depends on if you're having any discomfort. If you feel a lot of resistance or pain in your hamstrings, you can give a little bit of a bend in your knees, which will release the hamstrings a little bit too for you. So kind of find a position that feels comfortable to you where you feel a good stretch, but you don't feel any pain or discomfort. All right, Mary, you can go on and stand back up. Good job today.
Well, thank you, Heather, for doing those exercises. Those are some really great things that hopefully you all can start using at home. And we hope that you have enjoyed the class tonight. So we are just going to go into some key takeaways from everything that we've talked about, right? So one of the main themes that we want you guys to understand is the importance of proactive care. So a lot of the stuff that Heather and I talked about tonight, between good bladder habits, good fiber intake, right? Being aware of what's going on within your pelvis. You can use those tools even if you don't have any pelvic floor issues. It can help to prevent those issues from occurring. So we really want to try to stay on top of things so that they don't become an issue down the road.
We also discussed the benefits of core exercise and maintaining a strong core and the connection between our abdomen and the strength in our abdomen and our pelvic floor. Maintaining that strong pelvic core will help also maintain a strong pelvic floor. So it's important to implement these exercises into your daily routine to help with your pelvic floor health.
And whether or not you have pelvic floor issues or you don't and you're just looking to learn, there's still a lot of benefits to really being consistent with making some of these changes that we talked about today. We want to work day over day to create good habits, and that's what leads to really good long-term results.
We also have some more resources for you guys, including Indie Pelvic Health and Indie Flow. Both of these programs that are led by Mary and myself will help you kind of on your journey to pelvic health and increasing your range of motion and mobility and strength in your core. We also offer a 30-day free trial, which will be sent via email to all the participants in this wellness series.
So that finishes our class for today. Thank you so much for joining us, you guys. I hope you've learned a lot. I've learned a lot even. I hope you've been putting good questions too down in the chat below. Continue to do so because we'll be right back with our Q&A session with Mary and Heather.
How long has pain been holding you back from the things you love? At Buffalo Rehab Group, we understand that life doesn't pause for pain. No matter what's holding you back, we offer a wide variety of services when and where you need them, from your foot and ankle to your knees, hips, and back. Our experienced team of therapists will guide you through a personalized plan of care tailored to your needs, ensuring a transformative journey toward a pain-free life. Don't let pain limit you. Visit us at buffalorehab.com and get your life back today.
Thank you for coming to tonight's event. We hope you're learning lots and lots, and we still have plenty more to go through. We have kept track of some of your questions that you've been putting into the chat for us, and we're going to go through those now. But right before we do that, I want to remind you guys that as a thank you for participating and learning with us today, you guys will be receiving, after tonight's event, an email with a code that will get you a free month's use of our Indie Exercise Wellness app. It has plenty of programs within it that are PT design exercises that will go through helping strengthen flexibility for low back, spine, shoulder, neck, just strength building. We have a whole program written for yoga as well. So we want you guys to check that out, play in it. There's a lot of great things in there, and hopefully you guys will stay tuned to play with more of that. All right, so we're going to start with our first question that comes from Rita. Rita says, it's been about 8 months now since I gave birth to my daughter, but I'm still hearing air sounds when walking. I've tried different exercises, but the sounds never go away. What can I do? Mary, you want to answer this one?
Sure, thank you. So 8 months postpartum, I would say it takes your body about 18 months to 2 years to fully recover postpartum. So you're still in that healing process, which is honestly a great time to do some of these exercises. So having those air sounds when you walk tells me that it's a bit of a higher level activity, right? Because you're upright, you're moving, gravity is taking effect of those muscles. So you want to make sure that with doing some of these exercises like Kegels, that you are practicing them in standing. So you won't get as much of a positive effect out of doing the Kegels laying down because that's not where you're experiencing the issues. So practice doing some of the Kegels while you're standing, and practice even doing some squeezes on and off while you're walking. And over time, it should help that to get better and go away.
Awesome. Thank you. Okay. Question number 2. Dawa says, I have experienced leakage every time I sneeze, cough, jump, and even laugh out loud. Is there anything I can do for this? Heather.
Okay, so this leakage is most likely due to weakness of the pelvic floor. So again, we just want to work on strengthening the pelvic floor. So doing a lot of these exercises that we've previously discussed will help a lot with that. And also being sure to brace and do these Kegels and these strengthening exercises when you feel one of these coughs or sneezes coming on, or before you do any of these more aggressive movements, so that your body is prepared and you can kind of brace for it.
Beautiful. Okay, our next question is from Marie. She says, when I work out my abs too much, I have pain, almost like a knot on my right side. How do I work through this? We'll throw this to Heather.
So in order to kind of help before you do any more intensive exercises in general, it's always a good idea to make sure you're warming up as well. So going through a good stretching regimen to help kind of stretch out the torso, the back, even the hips before you start doing any more aggressive ab workouts is a really good idea. And also when you start to feel these really kind of uncomfortable or cramping feelings, you might be doing a little bit too much at once. So making sure that you're taking breaks after each set is a good idea. Just kind of make sure you're not overdoing it, and even alternate between stretching and ab strengthening exercises can help make sure that you're not overdoing it too much.
Very good. Beautiful. Okay. We have had a couple of questions about the exercises, people having concern about being on their knees maybe. So is there anything we can do to modify some of the exercises for knees? Heather, would you like to answer that one?
Sure. So obviously getting down on your knees on the floor or on a yoga mat might just not be enough cushion for you. So they do sell some kind of foam that you can put kind of on the ground over your mat to kind of help cushion it a little bit more. If you don't have something like that, you can even use like a thin pillow or something like that to help give you a little bit more cushion. But of course, there's always modifications to the exercises as well. So for example, the bird dog exercise that we demonstrated earlier can actually be done standing at an angle. So if you put your hands kind of on a table or a countertop, you can do this same exercise, same thing, alternating, lifting your arm and your leg, still bracing your core and getting that good strengthening in there as well. You can also do wall planks as a modification to the bear pose that we showed as well. So that's just doing kind of a plank, again, making sure you're bracing your core and your pelvic floor while you're doing this, and doing it up against a wall instead. So there are ways to modify so that you're not getting down on the ground for these.
Absolutely. Always 10,000 ways for you can do everything. So find what feels good for you. Okay, our next question. Lori asks, do we hold the Kegel muscles while performing the exercises that we showed, I think for our core strengtheners and all of that? Mary?
Yeah, absolutely. We want to engage those pelvic floor muscles, and some of the exercises are even designed to engage your pelvic floor. So when you are doing the bird dog exercise, your body actually naturally does a Kegel, and when you're doing the bridges, that also engages a pelvic muscle. Now, that in consideration, it never hurts hurts to do a Kegel on top of it, right? So with the bridge, as you lift your hips up off the ground, you can make sure that you're doing a squeeze of those pelvic muscles. With the bird dog, as you straighten out your arm and your leg, you do a squeeze. The same works for all of those other exercises that we were doing.
Perfect. All right. Antonia asks, can we actually recommend any of the good probiotics that we mentioned earlier?
Yeah, so I can say what I look for in a probiotic, and I will tell you all the one that I use. The brand that I use personally is Garden of Life, and I use the Once a Day Women's Probiotic. And the reason why I chose that is it has multiple different strains in it, so lots of variety, right? So it's good for not only our gut health, but our vaginal health and just like general probiotic health for our whole body. And the other thing with that is it has a prebiotic in it. So something about probiotics is that it needs a prebiotic to kind of feed off of and to activate. So you want to make sure, regardless of which one you go with, that it comes with a prebiotic in it to really be as effective as it possibly can be.
Good to know. All right. Barbara asked a question, I think, regarding the squatty potty. She said, couldn't we just also lean forward to create an acute angle at the hips instead of using the squatty potty? Mary?
I would say that bending forward or going up on your toes is something that might be helpful in a pinch, but it is not the same as putting your feet up on a surface such as a squatty potty. And this is because when you bend forward at your hips, you're actually not going to be getting all of that movement from your hips. You're going to get some of it from your back. And really where the squatty potty or just that positioning becomes the most beneficial is when our hips are flexed. So it won't have the same effect if we're getting that motion from our back instead. And if you don't want to commit to squatty potty and you want to try something else first, if you have just even a regular old step stool at home, you can put your feet up on that. If you have a little garbage can, if there's a bathtub in front of you, if you've got your spare toilet paper rolls in the bathroom, anything to just put your feet up on so that your knees are up higher than your hips will have the same effect as a squatty potty. And if you try that, I'm pretty sure that you will be amazed at how well it works. I know I was when I first started using it, and maybe you'll end up getting the squatty potty, or maybe the trash can works great.
I would say the nice thing about the squatty potty is it tucks underneath the toilet itself, kind of stays around the base and that, so it's nice to just kind of get it out of the way, and then it's not, doesn't need to be there when you're not using it. Okay. Lori asks, how often should we do tonight's exercises, thinking about rep sets holds? And is there a modification for child's pose? So let's give Mary rep sets.
Yeah, sounds good. So in general, when we are working on strengthening the pelvic floor, you really can do around 40 or so Kegels a day and be getting a pretty good workout for those muscles. And some of these exercises, like I said, if you're doing Kegels with them, they do count. So generally for these exercises, we have a pretty good variety here. It depends on what you're able to do, but most people are pretty comfortable doing somewhere around 3 sets of 8 to 3 sets of 12. If that's too much, you can always do 4 sets of 5 or just 2 sets of 10. It really depends on your level with where you are at, but generally those ranges are pretty good to be in. And again, that like 40 or so Kegels a day is really what's shown to be effective for those pelvic muscles to get stronger. If you want to do a little bit more, sure. Don't go too crazy though. We don't need to be doing Kegels all day long.
Perfect. And then
Add into that.
Oh, yeah.
So there was a question about the child's pose and a modification for that. What I usually recommend people do, if it's really bothering your knees to kind of flex them so much and put all your weight down, putting either a yoga block under your hips or a cushion under your hips can help kind of raise the hips up a little bit so you don't have as much of a severe bend in the knee. But also just finding like a good positioning of how wide or close together your knees are will affect how much your back is rounding into this pose. So if you spread your knees out a little wider, you're not going to get as much of a rounding in your back, and if your knees are closer together, you get more of that rounding. So you can kind of play around with positioning, but there's definitely modifications for that.
And I might even add, I have had some patients with, like, say, low back problems. They've had a fusion where they actually can't, like, round to their low back. That's, like, not an option for them. Taking a seat in a chair, sitting towards the front edge and being leaned forward over, like, a dining room table so that your forearms can be supported on there, and then working through the belly breathing while having your hips wide or knees wide to be able to work through that belly breathing and just kind of open up through the pelvic floor. I've done that with patients as well. Okay, and next, is there a PT for diastasis recti? Mary!
Me. So I do treat diastasis recti, but there are other PTs, including Katie and Heather, that can also treat it. So there are a lot of options when it comes to treating a diastasis or a diastasis. They are both the same thing, but it's definitely important to get it taken care of, right? We don't want to have that separation in our abs. We don't want to have that little bump there. So it's definitely worth, whether you're in Buffalo or not, looking around with local PTs. Any pelvic therapist would be more than happy to treat that. So looking into ones in your area that could potentially, give you some good results with working together.
All right, KP says, can we explain the air coming out from the vaginal area and whether the position of the vaginal area is problematic or how that can be resolved?
I would say there are certain things positionally where you will get air coming out of the vaginal area. Positions like child's pose, where maybe your hips are more bent, your hips are a little bit wider, that would be more of a position where you would expect that to happen. When it comes to walking, I don't know if there's a specific part in your stepping pattern, right, where that would occur. So that is something that you would maybe want to take a look at. Is it when your legs are further apart, right, that you're experiencing that? And again, the nice thing about Kegels is you can apply them in any way. So if you notice that there's a certain part in your step where you feel that air coming out, well then get in that position and practice doing some Kegels with your legs in that position, right? And that will help to work those muscles so that you don't experience that. Perfect.
All right. And then Columbo asks, can extra weight around the midsection add stress to the pelvic area? And how might we be able to work on losing it?
Yes, so definitely want to make sure that you work on strengthening the core. So sometimes that extra weight can also mean weakness in the core area. So working on these core strengthening exercises that we show you can help with that a lot. Making sure that you have a healthy diet and you're including these probiotics and vitamins as well in your diet will help. But kind of just working on the strengthening, stretching, and do you have anything to add to that?
Only thing to add would be to agree, right? So that having some more adipose around your abdomen definitely, what it does is it puts more pressure down on your pelvic floor, right? So all day long, our pelvic floor muscles are supporting our pelvic organs, our abdominal contents, right? So if we do have more fat in the area, it's more pressure. So think of it like you're adding weight to a bicep curl, right? It becomes a little bit harder, which can contribute to some of the symptoms if you have them, like urinary leakage or things like that. So definitely working on losing some of that weight will help to take pressure off of those pelvic floor muscles. And just like what you said, a nice healthy diet and regular exercise, probiotics, good gut health, stress management, getting enough sleep. There's a lot of recommendations and it's really hard to do all of them. So the easiest thing that people can do is find one thing to change and to work on that, right? A lot of times working with weight loss or just getting generally into a better active lifestyle is more about making a lot of small changes over time instead of trying to drastically change everything you're doing at once. Because usually if we can do that, we can't keep it up for long and we want those long-term results.
Awesome. Okay. Thank you guys so much for all of your wonderful questions. I hope you've learned so much from these two ladies. They have beautiful, beautiful brains and lots to share. I want to remind you guys that you will be receiving an email by tonight or tomorrow with that indie code for you to be able to use for a free month. We hope that you can play in there and find something that works good for you. Lots of great stuff to find in there. And I hope you've learned a lot about pelvic health. It's something that obviously we found a lot of interest in because a lot of people don't know about it or they don't know that these questions exist and there are answers for them. So if you find that maybe these have been helpful but you're looking for more, feel free to absolutely reach out to us to get connected with a therapist to work on these things. Find someone near you. But absolutely, if you have problems and questions, seek them out. We want you guys to be healthy and feel healthy. So thank you for joining us this evening and we hope to see you sometime soon.